You are watching the Doctalk show.
The coronavirus has taken a big hit on the global stage, and it's sad to see that countries in the Western world, in Europe, in Americas, are registering very high numbers of cases. But one wonders why in Africa the cases are not so many. Could it be that Africans are immune to the coronavirus? Well, who better not to ask our experts in studio to tell us more about this supposed theory. So, Professor Pauline.
Okay, thank you, Dr. Wachi. So, Africans, we cannot say Africans are immune to coronavirus infection or COVID-19 disease because as we speak, we know that very many Africans, including Ugandans, have been infected with coronavirus in the Western world. But also here in Uganda, we have had cases, positive, yes. So we cannot say that we cannot say we are immune to coronavirus. So coronavirus can actually infect Africans.
All right. But one wonders why the numbers are so small. The USA has like 1 million cases. So is it a matter of whose systems are better than the other? Can we argue that way?
So yes, that's an interesting question, and as Uganda, I think we can proudly say that our very early intervention helped us a lot. Looking the president's intervention to close borders really helped us to curb transmission of this coronavirus and to stop transmission into the community. So it was very early on intervention, but also we see that the people here who tested positive for coronavirus also had very early intervention. They were many of them were in quarantine where testing was done, and once they tested positive, they were moved into the hospital and intervention started immediately. The care started immediately, so they did not have the chance, if I may say in quotes,
but the disease
did not have the chance
to move into the community.
To move into the community, and also to really make our people very sick because they were in hospital, they were being cared for, the comorbidities were all being cared for.
Oh. So credit to the health workers who took care of the people who were diagnosed with corona in Uganda, and fortunately none of them has died, so they're all alive and well and healthy. So maybe there are additional factors we're yet to find out. Good enough is research is ongoing to tell us more answers about the coronavirus in the African setting. But moving on, Dr. Christine, young people, some young people think they can't catch the corona because they don't die. Everyone knows the corona mainly affects or kills the elderly. So is it true that young people can't catch it?
So no, it's not true that young people cannot catch coronavirus. And I think we've seen the numbers elsewhere and here locally as well. We've seen a young population. Uganda is a really young population. I think, I'm not sure the average age, but probably 30s, 40s. So we have seen young people here get it, but also abroad. We've seen children. We even had a baby here in Uganda. So some of the reasons why people think that children don't have, not that they don't get coronavirus, but that they get milder disease, is the belief that previous viral infections, you know how children always get these coughs and flus, and they're with similar viruses, because some of the normal cough and flu is caused by different types of coronaviruses. So the body is already almost primed and produced antibodies so that they're less likely to get severe disease due to COVID-19. So these are some of the reasons why we think young children are less likely to get severe disease, but not to say that they can't actually get the
They can get it, but it will be
they
very
can actually
mild.
get it.
Yes.
And there's also been a few more scientific theories as to why we are seeing less of it amongst the younger people, the children. We know that this virus, in order to cause disease in the body, once it gets into the body, it needs to attach to certain cells within the body to be able to cause disease. Okay. So the children, science so far shows that the younger children have less of those receptors where the virus actually attaches, and that may be a protective effect for the children. compared to the adults. But we are yet to see more. More
We need to
research
see
is
more.
going to
So
be
we can't
carried
really
out.
answer
Yeah.
all the questions.
Yes.
But what we know for sure, I think, can we safely say everyone is at risk of
Everybody
getting
is at
corona?
risk for coronavirus.
So likewise, everyone should take necessary precautions to avoid catching the coronavirus. We're talking about precautions is the contentious issue of masks, whether masks are extremely 100% protective against corona. Some countries are advocating we should use cloth masks as a measure to prevent infection. Could that be true? I don't know. Is that a myth or a fact?
So we know that coronavirus is a virus. And we know, Darius, you know very well that viruses are very, very small particles.
Some people, I think, may not know. So
Oh, yes.
I think we will assume they don't know.
So viruses are very, very small particles. They're smaller than a particle of dust. So they're
tiny.
carried, yeah, they're very tiny. And they're carried in droplets. So if I sneeze out, then I will release the virus in that kind of droplets that comes out when I sneeze. And that virus goes across to the next person standing next to me or sitting next to me. So if that person has some form of protection covering their nose and the mouth, then my droplet will not fall on their mucous membrane.
It will
and
fall
therefore,
on the mask.
Yes, it will fall on the mask, and therefore their chances of getting infected with the virus will be very, very slim. So there are different types of masks. From what we call the N95 mask to what Dr. Wachi has just described as the cloth mask. Now, the N95 mask, we all know, will not let in 95% of the viruses that you come across, you encounter in these droplets.
So it will
screen out
95%
95% of it. It's not 100% protective, but it will give you up to 95% protection. When it comes to bacteria, it will screen out almost 100% of the bacteria. Now, when it comes to the cloth mask, there is still a lot of contention, a lot of discussion on this cloth mask. We know that the cloth mask will have bigger spaces and therefore more likely to let in smaller, the very tiny particles. But we know that the cloth mask at least will protect you from the particulate.
It will reduce
the particulate
total
matter.
amount.
Yes, the total amount.
Okay. I think likewise, if someone is sick and they use a mask, even that
Yes.
cloth around it can
Because it will
prevent so
stop
many
the
things
droplets
going
from
in the
coming
air.
out. Yes.
So it does play a role in
Yes,
some way.
it plays some role.
I think the issue also is if you're wearing a mask and you go out in public, you may feel protected. If you're wearing a cloth mask, you might have a false sense of I can't get an infection, and yet we don't think that that cloth masks are 100% safe. So I think that there's still a lot of uncertainty about how much protection it will be able to give. So if we decide to go out and say we're using cloth masks, I don't think we should absolutely get a total sense of protection that I am protected totally because I'm using a cloth
and
mask.
still going to a crowded
Yes.
place. But we can still use cloth masks and then still keep our social distance and still do the
So it's a
hand
combination of
washing.
preventive
It's a combination
measures.
of
Yes.
things.
The social distance is very important because science has shown us that the droplet that contains this virus actually can only move up to a certain distance of
1
up to
meter.
about 1 to 2 meters.
Yeah.
So if I keep the social distance of 2 meters, I'm less likely to get in contact with this droplet that contains the virus. So it's a combination of factors.
It's a combination of factors.
The social
distancing,
disinfecting, hand
Yeah.
washing,
and
yes.
possibly the mask
The
play a
face
role.
mask. Yes, absolutely.
Absolutely. So coming after the break, does eating garlic kill the coronavirus? Well, a very interesting nutrition debate, and our experts will be happy to answer that. So stay tuned, don't go away. We'll be right back.
You are watching the Doctalk Show.